have you here. Let's have you right here. Doctor, right here. Well, you know, I'm not a lottery guy. I don't play the lottery. I don't play the slots. But I feel like I really lucked out today. Because I'm on stage having a conversation with two remarkable women, people who are acclaimed and celebrated in what they're doing. And I really felt like, okay, Aaron, acknowledge it. You're a lucky guy to be talking about something today. Because I'm here with Dr. Purvi, and I have the chance to talk with a woman who works on these issues that we just heard about and were inspired about. And I'm here with Zoe Saldana, who is a celebrated actor and advocate. And you have a new title in your life. You have a title of mom.
Yes.
So I'm going to start there because I know that Hollywood and in everything related to the entertainment world probably talks about a lot of your titles. But I'd like to start off our conversation asking you, Zoe, to tell us about this title of mom. What's it meant to your life and what's new in your life now that you're
I know it's my calling. It's literally the best title I will ever have, I will ever want. I learn every day. I realize that I'm a student, and I'll be a student every day of my children, of other mothers, of women, such as Dr. Purvi, that are constantly educating me on how I can just be a better parent for my kids.
You know, hearing you say this, and I want to talk about this more during our time that we've got today, I love the fact that at the Global Moms community and the Moms Plus Social Good, that people are sharing stuff they're learning. It's not like you've got this, because I see you, and I'm a fanboy, and I figure, oh, Zoe, she's got this, right? Because she's got it all together, she's got it, but you're learning things.
Completely, and I think that the empathy that grew bigger after I became a mother, not just for my children, but for other children, gave me this curiosity to just continuously educate myself. And one of the biggest controversies for us, especially in Hollywood, you know, because of what I do, is vaccination. And once we were faced with that question of, okay, when are we going to vaccinate our kids? You know, we have twin boys. They're 2 years and 5 months now, but they were 8 weeks early. And they had very precious immune systems, and we had to keep them away from the public for many reasons until they sort of like their little bodies would mature. And vaccination became a constant debate with us as parents. We knew we were going to vaccinate, but the question was, when do we expose our kids, you know, to the neighbors, to a park? When do we take them to a mommy and me class? And are we running the risk of exposing our kids to other kids that are not vaccinated? And what does that entail, especially us, because we have kids that were premature.
And you've got, like all of us, the fact that you've got those questions. And so often, a person who's a celebrity or who's known around the world, and you're a global advocate for an issue that really matters, so important, but people oftentimes think that you've got the answers to these questions. I'm going to ask you, doctor, you are, you know, NYU's Langone Center, you know these issues. Again, you've got all of your wall, I'm sure, is filled with certificates, right? But you must get that simple question, but an important question from parents all the time. What do you tell them? What is that reaction to? If Zoe was in your office today, what would you tell her?
So what I tell everybody is a vaccine is the single most important thing you can do for your child. It is the leading cause of preventable deaths if children who haven't had vaccines. UNICEF estimated last year that over 1 million children died because they didn't get vaccines. So that's over 1 million preventable deaths. It's the most valuable health investment that you can do for your child. And not only are you protecting your own child, you're protecting everyone's children, everyone's elderly parents, cancer patients. It's the one health decision that affects everybody, not just you, you know, and you're not an island, you know, people are coming in from other countries, and you know, an outbreak anywhere is an outbreak everywhere. So the outbreak in Africa that you think may not affect you, actually, it can come to New York tomorrow, and we've seen it happen.
Or an outbreak in Disneyland.
Correct.
Which is what we had.
And you were just telling us about that. Tell me a little bit, Zoe, about your family. You come from a very international, you're an international person. Yep. In a lot of ways, you represent the fact that our world is very global, and you're upbringing was one that was global too. So you've seen that these things are close, even if they might not be in your home, they're in your world. How is that?
Well, we had a very unique, pilgrimage, I guess, because we were born here in New York, and when I was 10, my mother moved my sisters and I to Dominican Republic so that she can be closer to her family, raising us because my father had passed away. So we basically had the reverse kind of exposure when it comes to immigration. We were in a country that is like America, like the United States, and all of a sudden you go to a developing country and you're exposed to so many things that you would have never been exposed to now that you're living in this island, and I had firsthand experience and contact with people that were just living 3 hours away from the city that I was, and children that were just dying of just the rotavirus, of just all these diseases that in my mind, even when I was 15, I would think, but they would be vaccinated, right? And these questions that arose sort of like began this inquiry that has grown immensely within me now that I'm a mother. Most is how little we know about vaccination and vaccination preventable diseases, and how children are just the negative recipients, and that we have the ability to make change, to really help kids. So that, I guess, living in a country like Dominican Republic, that's amazing. I mean, you can fly to Punta Cana and to that beautiful resort and have an amazing vacation with your family, not knowing that 3 hours away in some town, there are kids that are being exposed to vaccine-preventable diseases, and that their lives are at risk every day. And that's something that I just want to bring awareness to that.
I think hearing it from your voice, I know that people in this room or people who are tweeting about it or posting about it, it's spring break time. Mm-hmm. And I think that's a good reminder, right?
So.
We travel a lot, we go places because we want access to the world, but not all the world has access to vaccine preventable diseases. So, and I want to say it should be said, it takes guts to do it, especially in your community at times. So we want to thank you for doing. Can we give Zoe some love? Let's give her some love for doing it, because it takes guts to do it. Especially when these are your most precious things, right? And those are your kids. So I want to move from the Dominican Republic, if I can. I want to move around the world to show that this is something that is global. And you've clearly been preparing for your role as global advocate from your youth. You in your study and your travel and in your family as well, I'm sure you've had the exposure to these issues. Right. But you were in Zambia recently.
Right. So
tell us about it and what stuck out from your trip to Zambia as a professional and as a person who cares about your family.
Right. So it was a remarkable trip, and I had the opportunity to go to Zambia with the UN Foundation's campaign Shot at Life. And what really stuck out was all of these mothers that I met would walk on average of 4 hours in the sub-Saharan heat to get a vaccine. And we would interview them and ask them, why are vaccines important? They're like, well, this is to give my child a chance, basically. So things that we take for granted. And when we asked, would you vaccinate all of your children? It was without a doubt. And that blew me away, because here in New York, where everyone has access to everything, on a daily basis, I have to convince parents to vaccinate their children, whereas abroad, where they are very resource poor, don't have electricity a lot of the times, to them it was a no-brainer. Like, they looked at me like I was crazy. Like, why wouldn't I vaccinate my child? And I think that's how it should be, because you have that ability to make an impact to protect your child and all the other children around.
I'm a communications guy, so I'm going to call you on the fact that Dr. Parikh has done something already in this interview that I love, because you've made the point that it's not just about the kid. You love the kid.
Yeah.
The kid's yours, maybe, or but you've already said a couple of times it's the other people in the community. You've mentioned the elderly. You've mentioned cancer patients or people who are recovering. So when you were in Zambia, were they teaching you that? Were they aware that this was going to have an impact on the village or the town at large?
Right. I think that is why that's why they would walk 4 hours in 90-degree heat, because they've seen entire villages get wiped out from measles. Where we don't see that, so we don't realize how lucky we are to have that vaccine. So to them, they're like, well, come hell or high water, I'm getting my child this vaccine. And it was quite remarkable, especially how strong the women were there.
Remarkable and strong moms. Speaking of which, Dr. Parikh, your mom is here. Is she here, Mom? I'm going to embarrass you. Where are you? Stand up or raise your hand to me. Where are you? Stand up. Take a bow. Good job. Happy Mother's Day to you. So to have a daughter who's helping to make sure that people have access to health, happy Mother's Day. Good work, Mom. I want to talk about this, this issue about why, because there's reluctance. Zoe, you've got millions, last time I checked, gazillions of people who follow you and you're fans, right? They love your work. I mean, come on. We all know it, right? I mean, you've been called one of the most adaptable actors because you've had roles as varied as Star Trek and Avatar, and you've been in places everywhere. My Little Pony, so cool. I mean, everything, the whole gamut, and you're able to do it, and people feel like you're telling them a story. So what is it that's keeping people, and I pose this question to both you ladies, what is it that keeps people from doing it? If they know, or at least we have the data that says it can keep you healthy, what's keeping people?
I think it's fear. It's that you mean that's keeping people from
vaccinating their kids.
It's absolute fear, but it's a fear that's stemming from a lack of knowledge and accurate information, and also I happen to think that a doctor may have more experience in vaccination, so I would probably ask that question to a doctor. I wouldn't just go to my neighbors who doesn't have, is not in a medicine field, a medical field. I would ask an expert, and I would want to sort of know facts. I would want to know, sort of like educate myself about statistics, and I feel like what's preventing people is a fear of just not really knowing something, but thinking that you do.
And that idea that, because we kind of always do want to have the answers, right?
Yeah, and it's not, I fear for the children whose parents have it all figured out.
Yeah, that's right.
It's like every day your kid is the one that's letting you know, and if it's not your kid, it'll be someone else's kid, that's letting you know things that you should be knowing more, and you just have to pay attention to those cues. So when I go on a website like Shot at Life and I watch these documentaries and these footages of these mothers, of these families, these villages of people that have now that they've been negative recipients, direct negative recipients of not having vaccinations accessible to them, and now they know better, they're actually doing better. What am I doing if I'm in Los Angeles, and I have access to so much more? Why am I not doing better? So that duty, that sense of duty is what keeps me always inquiring and learning and not saying no because of fear,
right?
And the fear of coming off as if you don't know everything.
Yeah,
so what you
it's
just
okay
said,
to not know.
Yeah.
So this idea that I'm sorry for those kids whose parents have it all figured out, it's making me realize that as a parent, I want my kids to hang out with kids whose parents are still learning.
Yeah.
Right.
And that's vulnerable. It's authentic, but it also is community, right? And I think that's
community, yeah. And to not be afraid to have these conversations. Yes, they'll rise, debates will rise, and sometimes they'll get heated, but the fact that we are challenging ourselves as a parental community to care for our children can only be beneficial for our children. And to know that organizations like Shot at Life are not just helping our local communities, but they want to help global communities. It's up to us to understand the power that our social media abilities have when it comes to just reaching other people and educating each other on something that we should know better of, I hope it makes sense.
It does. And so what do you see in your office as some of those reasons?
So that's why I'm very glad that people like Zoe are involved who have such a wide reach, because a lot of times it's misinformation. It's fear, yes, but there's a lot of miseducation on what vaccines are, what they can do, the safety of them. And unfortunately, there are also people with large platforms that are spreading the misinformation. So it's very nice and refreshing to see, people using their platforms for good. And so that's the biggest misconception I see is just complete lack of accurate knowledge about it. So people think they know, but they don't.
Exactly.
I think I want to conclude our conversation, and I could sit and talk with you guys for a long time. So I kind of wish we were stuck on a train somewhere, stuck on a plane somewhere. But this conversation is going to continue, and I think in the spirit of the Moms Plus Social Good community and our partners at Johnson & Johnson and the people who've come together, let's be as vulnerable as you say we all need to be for a minute. And I want you to share share something. I'm going to start with you, doctor. I want you to share in your journey of being part of this conversation in your studies. What's one thing that you learned that you didn't know before? And then the question's coming to you, Zoe. So, doctor, what's one thing you learned that you didn't know that you're willing to share with this community that we can share?
Well, the reason I got into immunology was I learned that flu can kill people, and I didn't realize that till I was a first-year resident. And I took care of a 34-year-old mom who had 2 young kids, and she died. And I was shocked. I mean, she came in with the flu. She was very sick, and she was in the intensive care unit. We were taking care of her, but I was shocked. I just assumed a young mother should be able to bounce back from that. And even being like a resident in my medical training, that was an eye-opening experience for me.
Thank you. Zoe, what about something that you learned?
That that I have the ability, no matter how big or small I may feel, to impact a life. Not just a life that's in front of me that I can touch, but to really impact the life of a child in some village somewhere in Africa that I will never probably see his face. But if I am able to support an organization that gives them a shot at life, then I've made my change in the world.
You know, people and the headlines are full of everyone saying that we're all pulling back.
Yeah.
But Dr. Purvi Parikh and Zoe Saldana today have proven to us that the world's a good place. We're all trying to take care of each other.
Yes.
We want to thank you two for being advocates
Thank
for
you.
the shot at life that everyone deserves.
Thank you for having me.
Thank you.